everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a event that has been taking place all throughout the week, and I wanted to contribute some more. I had one video about the Black Maternal Health Week, but haven't had too many since then. So I wanted to create a video before the week ends. And so this is known as BMHW26. So here's some tools and ways that you can help promote the understanding of what is going on. This is their 10th year anniversary. So this has been going on for 10th year. And this is a milestone theme reflecting the strength and resilience of Black-led perinatal, maternal, and reproductive health organizations. So it's about acknowledging that there is systemic oppression, reproductive injustices, and health inequities that continue to impact Black mamas. And I know I attended one session one of the years at Walden University, and there was doula care and a lot of different types of help for mothers that were Black. So I'm going to go over some statistics now. First of all, though, I want to kind of get rid of any sort of myth about this. Black mamas are not just African Americans. That also includes gender diversity, African descent, such as Afro Latinx, African American, Afro Caribbean, Black, and African immigrants. So there's this building towards a liberation unapologetically. Intentional change has been fostered. We have been on the front lines. So this is a social movement that is really making a difference in people's lives. In 2023, here's the statistics from the CDC. 2023, the maternal mortality rate for non-Hispanic Black women was 50.3 deaths per 100,000, and that is nearly 3.5 times the rate for non-Hispanic white women. And that is alarming because that's a lot more deaths, and there's ethnic disparities that are taking place. Maternal deaths decreased from 2022 to 2023 for all racial ethnic groups except for Black women. Also, Black women are over 3 times more likely to die from a pregnancy-related cause than white women. CDC notes that more than 80% of pregnancy-related deaths are preventable. So these are some alarming statistics that affect Black women more than white women. And so Black women have higher rates of cervical cancer. Black women are more likely to die from cervical cancer. Uterine cancer is one of the few cancers with increasing mortality and death rates by 1.7% since 2000s. Black women are more likely to die from it. So higher likelihood of certain cancer like cervical and uterine cancer. Fibroids are growth causes bleeding, infertility, pain, pregnancy complications. Black women have higher rates of uterine fibroids. And then compared to white women, Black women are almost 4 times more likely to be hospitalized for a fibroid-related issue. And of course, African Americans are more susceptible to sickle cell. And so these are all areas that require more attention among Black Africans and Black African Americans. So here's more about sickle cell, menstrual health. More women experience menopause between the ages of 44 and 55. One study found that earlier onset of menopause in Black women is associated with smoking, lower BMI, and individuals who did not use contraceptives. So here's mental health conditions, and I'm very keen on understanding mental health. Mental health conditions are a leading complication of pregnancy and childbirth of mortality, with perinatal mood and anxiety disorders affecting up to 1 in 7 pregnant and postpartum women nationally. Although Black women are more likely to develop perinatal mood disorders, they are less likely to receive treatment when compared to the white counterparts. So these are some important statistics in that maternal health is of mental health is neglected due to and due to misunderstanding about Black conditions and whatnot. So in the US, about half of Black women experience postpartum depressive symptoms, yet few are properly identified and are connected to mental health services. So I'm not going to go over this too much. This is quite a few pages here, and this goes into a lot of different um, mental health issues, breastfeeding, a lot of different reproductive rights and justice, key access to care, quality of care, maternal vaccinations, environmental justice, climate change, and Black maternal health. And here's doula collective, like I was telling you. So I'm not going to go over all of these, but I think this is cardiovascular health, fertility. I think this is worth perusing at the end. And here's ways that you can help out during this week. And so my contribution is to post this in social media such as LinkedIn to spread awareness about Black maternal mortality. Um, so this is all I had for here. I hope this has made some sense. Thank you for listening.